Komernacki, and in this video I'm going to be going over all the best ways to pay for senior care or elder care in Michigan. This does apply to most of the country, but there's a couple small plans in Michigan that can provide some extra juice, and there might be some in other parts of the country that I'm not familiar with because, hey, we're from Michigan. But this video is probably well worth watching. But let's get into it. How do you pay for taking care of your loved one? Should you go to a nursing home that's skilled care? I don't think so right off the bat. Listen, nursing homes are phenomenal for a lot of people, but if you're just barely needing help, they might be the most expensive option and they might be a drastic step to take. So what we're going to be talking about here is, and in full disclosure, I'm biased because I work with Assisting Hands Home Care, which provides private duty care. So I'm going to talk about the early levels of home care. But do the math on this one. Some of these nursing homes, even independent living nursing facilities or independent living senior facilities, I should say, are like $4,500, $5,000 a month. And you're not getting help paying for that kind of stuff. You have to use retirement savings. You have to use reverse mortgages on the house to pay for these things, or you have to come out of your own pocket if you have the money. If you can't afford it, there's things like Medicaid, but that I'll get into that as well. But the main thing is do the math. Potentially getting a private caregiver and still living at home, you know, getting this private duty caregiver for 4 hours a few times a week or 8 hours a few times a week could be much cheaper than paying, you know, $5,000+ at these facilities. So what I want you to think about is do the math. And full disclosure, it's like $25 to $40 an hour in Michigan to pay for a private duty caregiver. It's expensive, but if you do the math, it could be much less expensive. And the reality is you have to do the math is how long are you going to need to be in a nursing home? When you add up the months or the years, you have to see what that price tag is. And don't worry, I'm going to go into some options in case you're like, how am I going to pay for this? This is insane. But do the math. A private duty caregiver plus living at home or in an apartment or in a senior facility can be the much better financial choice. In order for insurance to pay for home health care and dementia care, you need a few criteria. You need to be homebound and you need to be seeing a doctor who can write you a prescription and certify your care. And you must be homebound. Now, homebound means a couple different things, but generally you should have a very difficult or complex time getting to your doctor's office. So what that means is mobility issues, making it very difficult to transport because, hey, we can all call an ambulance and if 6 people are helping us, everybody could probably get there, but it's not practical. So Medicare covers intermittent skilled nursing. This means maybe 1, 2, or 3 visits and short visits per week. It covers physical therapists, occupational therapists, speech language pathology, social services, an aide to come and help once or twice a week, and maybe durable medical equipment. This does not mean somebody's coming for 4 hours to sit with you or for 8 hours. That is something called senior care or private duty care. This is generally private pay. So this would be a service like Assisting Hands Home Care, which I link down below. But these are great services where you necessarily don't need to follow all these pre-qualifications because the goal of skilled nursing is for very short chunks of time. It's not for 24-hour care. It's not for 8-hour care. It's not even for 4-hour care while you need to take a break to go to the store or go run some errands while your loved one needs care. This would be more of a private duty care. So that's where the two health care and home care services differ, although the names are pretty much the same. Consider that private duty home care that covers that type of care and services. And just to talk about that price a little bit too, Assisting Hands Home Care for the average person is on the very lower end of that. We bust our butt to get you the best possible caregivers at the lowest possible cost. And it's not easy, especially with inflation going up. It's brutal these days. So number one, does Medicare cover home care? The answer is Medicare covers intermittent home care. So intermittent home care means basically a nurse can come once, twice, or 3 times a week for like 15 minutes. So this is for skilled care. This means like changing dressings, changing catheters, checking up on you after a surgery. But the reality is for each time a doctor recertifies you, it's maybe like 5 visits. So they try and see you as little as possible. Otherwise, it'll bankrupt the home care company. That's the tough part is Medicare is fee for service. So what that means is they get paid for like one lump. So they're not going to come and stay with you for 8 hours a day, every day. It just doesn't happen. Our healthcare system's not built that way. That's where a private duty caregiver comes in. Insurance companies generally don't cover what's called custodial care. They cover short-term intermittent care for short durations. So it does not cover 24-hour care. It does not cover homemaker services, house cleaning, bathing, dressing, or using the bathroom. It does not cover medication reminders or rides to your doctors. This would be taken care of what's considered private duty home care. So a company like Assisting Hands, which full bias alert, I am a big fan of and part of, but Assisting Hands can help with all of this. It can help you get to the doctor's appointments. It can get you help with those 24-hour daily living tasks. So if you're in Michigan, give us a call or check out the website. Check out the ebooks we have on the rates, which are very competitive, and the different ways to pay for it. And so for that extra stuff, Medicare will pay for those specialized visits like a dressing change. It will pay for physical therapy, occupational therapy, a social worker to come out. It will pay for some medical equipment, but it does take a long time to get that medical equipment. We're talking Medicare paying for short visits. It's not the type of long-term care people think about when they Google or search up home care. Number 2 is Medicaid. So I have an ebook below that gives you the specific values, and they're going to be added up. But generally, I think you need to make something like at poverty level per month. So it's just over $1,000. I think it's just under $1,100 currently per month. So you have to be making $1,100 or less per month. And I think you have to have all of your net assets like $2,000 or less. So if you own a house or if you have any reasonable amount of money coming in, you won't qualify for Medicaid. And even still, even if you qualify for Medicaid, you still have to apply for hours. So I know just a lot of the clients we work with, it pays something like $11 an hour, which in our opinion, it's impossible to find a caregiver for that much. Impossible. Like if you're a family member that's taking care of a loved one and they're on Medicaid, you could potentially find a way to qualify yourself. Although I personally haven't done this, but it is down in the ebook. So I know people do it that way, but really, are you going to hire a reliable person for $11 an hour? You can't. It's impossible. Like McDonald's pays a lot more than that. Fast food pays a lot more than that. And being a caregiver is a brutal job. We see people that try doing this on Medicaid, but the caregiver leaves almost immediately after they agree to it. And the tough part is, do you want to leave your loved one with someone that's not really enticed to be there? That's kind of the difference between Medicaid covering that and an agency that you're paying a notably higher fee for, like $25+. The difference is we make sure that somebody's going to be at your house. There's days where like 4 caregivers can disappear and we have to find that 5th backup to keep you covered, because you don't want your loved one just abandoned during a snowstorm or, when COVID's going around or somebody's sick. You need a team with backup options available, especially with how important these services can be. So Medicare is more intermittent care. Medicaid, it pays very, very little to the point where nobody really takes Medicaid. That's why you hear in the news nobody takes Medicaid, because it's almost impossible to run a business taking Medicaid. That's a biased opinion from me, but I know in the county where I live, not a single person takes Medicaid, not a single one for these types of service is out of the entire county. So there are waivers and things for Medicaid, and you have to apply for hours. So even if you have Medicaid, you still have to apply for hours. And maybe it's like 4 hours sometimes. Sometimes you can qualify for more if you have illness. After Medicare and Medicaid, you have long-term care insurance. So long-term care insurance could be a great option. So I'm going to link a video to our long-term care insurance video where we talk for about 25 minutes about long-term care insurance. But basically, here's how I'll sum it up. Long-term care insurance, if you're in your 40s, it costs something like $60 a month so that you're able to spend something like $5,000 a month when you're older and retired. And this has to be a doctor's note that writes you qualifying for long-term care insurance. So as an example, at my age, I'll be paying like $60. And if a bus or something were to hit me and I need long-term care insurance, I can start spending my money if a doctor writes me a prescription. But for the average person, you get a better deal when you're younger. So if you start in your 40s, it's probably like 50, 60 bucks for a plan that'll eventually pay you $5,000 a month. Or when you're in your 60s, maybe now it's $200 or $300 a month for a plan that will eventually pay you more. If you have health illnesses, so usually heart, lungs, kidney injuries, anything like that, there's like 300 plus conditions, but they completely eliminate you from long-term care insurance. So if you already have heart disease or COPD or emphysema or something, and now you want long-term care insurance, they won't sell it to you. It's too late. There's only like 12 companies that sell it. But basically, if you start young, it makes sense. If you think ahead of time, 50, 60 bucks, or when you're older, you can get it for 250 bucks. But if you already have these illnesses, you probably won't qualify. So you have to do it before you get sick. These insurance companies, they don't want to lose money. And then a doctor has to write a prescription saying, hey, you need long-term care. And then you still have to submit paperwork every couple months. But this will pay for a caregiver. This will pay for rides. This will pay for nursing homes, like living in a nursing home. But again, you have a small pool. Like if you're paying that much money, it'll get you $150,000 to $300,000. Eventually it runs out. You know, if you're just going on forever, it could run out on you. But the next thing is, what you need to do is you have to keep supplying that paperwork, and you had to have kept paying your fees ahead of time. But you have more flexibility. You can stay at home with a caregiver, or you can go to a nursing home. But at the same time, $5,000 a month won't cover a $10,000 a month skilled nursing facility. You still have to come up with a difference. But this is where living at home or an apartment like a senior complex with a caregiver part-time or full-time can make sense. Or even having, 2 or 3 people splitting a caregiver at one of these facilities can make sense at the same time too. This could be much better for you financially. In Michigan, there's a plan called HealthLink. So this is a combination of Medicare and Medicaid. It sounds fine and dandy, but you need to be in like certain counties, and it's only like 11 counties in Michigan that offer it, and they're all more rural or Detroit area. They're not Metro Detroit area. So if you're in a better off area, this HealthLink plan won't really help you, but click below for the ebook, and this will give you some more information. VA benefits. If you are a veteran, get a hold of us. We can set you up with a representative who can get you benefits. But basically, veterans are very well taken care of, probably better than any other group in terms of long-term care insurance. Hey, you in America have, risked your lives. You really put a lot at risk to protect us. So this is a great service. Thank you for your service if you're a veteran. But we work with veterans benefits. We love our veterans. We love taking care of veterans. There are plans that can help you, but veteran insurance can give you a lot of coverage during the month. You have to apply for it. We have veterans affairs advocates, people that can help you, elder law attorneys that can help try and get benefits for you through the VA. It's a lot of paperwork. You have to work with your doctor to be able to qualify. It's a little bit of a process, but once you get through it and you get those benefits, it is well worth it. So if you're a veteran or you have a relative that's a veteran, apply for these benefits. Don't feel guilty. You guys worked hard for our country. You deserve it. A reverse mortgage. So these are the ads you see, like the reverse mortgage loan. But basically, if you paid off your house, you can get some equity out of it. Like I said, $25 to $40 a month is expensive, but if you don't have long-term care insurance, if you don't have help, then realistically, you might need this money because otherwise your relatives are going to pay for it anyway. So potentially, what I recommend doing this, don't just go and call up a company and reverse your mortgage. Give us a call. We have some great elder lawyers that are very, very qualified, very ethical. very well reviewed, that can help your family through this difficult process and figure out how to pay for this stuff. But the bottom line is we have a great ebook down below with all the benefits, all the plans. Look into an independent living facility or your own house and paying a caregiver part-time, 4 hours, 8 hours, whatever, to get you to your doctor's appointments, grocery stores, helping out. It's a lot cheaper than moving into a nursing home. But if you need to be in a nursing home, you need to be in a nursing home. You can get evaluated. Medicare, Medicaid, these things can help, but nothing replaces the private duty caregiver, in my opinion, my biased opinion. Assisting Hands Home Care, we're the best rated. You can come talk to us, no obligation advice. Click below for our ebooks, see why we're the best, see why we're the most cost effective, and I look forward to seeing you guys in person. Private duty home care is not the cheapest. It's like $25 to $40 per hour on average across Michigan. That's why we came up with a book. How can you pay for these things? At Assisting Hands Home Care, we try to provide competitive prices and open up all options because it's not cheap. Nursing homes are even more expensive. So if you don't need one quite yet, consider private duty home care as an option. And if you need anything, just call our office. But check out some of these videos, subscribe, let us know if we're doing a horrible job or a great job. We could definitely use the feedback to keep making you great videos. Thank you.